Hey everyone, I'm Justine, and I just want to welcome you to our celebration of World Thrombosis Day. This is the 10th anniversary, and this is something that I never thought that I would be celebrating or be a part of, or that I even had any idea even existed a few years ago, until I unfortunately did get a blood clot, and it was surprising and it was shocking, because it's not something that you would think that someone young and healthy gets. But it's pretty wild how this does affect so many people. But I'm so excited to be joined with three incredible guests today. We have Jean Connors. Hi, Jean. Now,
Hi, Justine.
I'm so excited to see you again. So, do you want to give everyone a quick little intro and why you're here today?
So I'm a member of the World Thrombosis Day Steering Committee, and we do a lot of work to bring public awareness to the existence of blood clots and venous thromboembolism. I'm a coagulation hematologist. I'm a physician in Boston at Brigham and Women's Hospital and Dana-Farber Cancer Institute, and I take care of patients who've had blood clots, or we want to even try to prevent blood clots in some people. So thank you for having me.
Thank you so much. Now, Kelsey, I think you're a six-time blood clot survivor. I don't want to get your numbers wrong here, but you have been through a lot. So, do you want to share quickly about why you're here?
Sure. Hi, everyone. It's so great to be here. My name's Kelsey. It's actually 7 as of July of this year. So that number has increased a little bit, but I'm here to speak on this panel because I found World Thrombosis Day about 2 or 3 years after I suffered my first and second blood clot. And since they have given me the opportunity to speak to others in situations and opportunities like this, and it's amazing to get the story out there, to network. I've met amazing people who have had the same experience. And it's just something where you can broaden your community, but also create awareness on something so important and near and dear to my heart.
That's awesome. Well, thank you. And I'm so sorry that we had to add another one to that, but I'm so glad that you're here to share your story. And next up, we have Gabby. You are one of the most popular Instagram stars in Brazil. Now, let's talk briefly about why you're here and your clot story.
Hi, guys. So I'm Gabby. I'm from Brazil, and I'm super excited to be here talking about this because I never really had a chance to talk about my experience. It was just once, but I know the importance of this subject, and I don't see as many people talking about this, and I'm happy to be here. I'm so excited to be talking to you guys.
Thank you so much. So now this is in celebration of World Thrombosis Day, and this is the 10th anniversary. And this entire campaign and the entire reason behind this is to really raise awareness about blood clots. Now, this whole global campaign takes place, and this is really, it's kind of a critical thing that I feel like a lot of people don't understand. 1 in 4 people globally die from conditions related to blood clots. And what's incredible about this campaign is really bringing people together to kind of share their stories. Now, before we get into more in depth about, ladies, your stories, I would love to hear more from Jean about what exactly is a blood clot and just some more medical terms that we may not completely understand.
Well, thanks, Justine, and I'm delighted to be here with everybody, and I'm sorry you've all experienced blood clots. I'm going to start very simply. Blood clot is like, if you cut your skin and it stops bleeding because of a clot. But the big blood vessels inside your body, the veins, move more slowly than the arteries, and they can get blood clots inside them whenever there are a number of different types of factors that can provoke a blood clot, such as trauma, such as low flow or slow flow through the veins, such as if you're sitting in one position for a long time, such as like a 6-hour or a 15-hour plane flight, or if you have other factors that increase the stickiness of the blood is the easiest way to say it. We call it a hypercoagulable state or a prothrombotic state, but many different factors can affect how easy it is or how hard it is for the blood to clot. And so some of the factors, particularly women, experience increased risks with estrogen, progesterone containing oral contraceptives. During pregnancy, actually, women have the highest risk of having thrombosis during, say, 20 to 50 years because of pregnancy. So they have a higher risk than men during that age period because pregnancy is a risk for getting blood clots. But there are many, many other risks for getting blood clots. Some people inherit risks for blood clots, infections, inflammation. I could go on, but I won't. But that's really when we get a deep vein thrombosis because of particularly not moving. That's usually in the legs, although Justine can tell us about her experience with the deep vein thrombosis in the arm. And then some people get pulmonary embolus, which is actually blood clots in the lungs. And these can be clots that move from the veins in the legs through the right side of the heart to the lungs, and they get trapped in the lungs, or they can sometimes form in the lungs directly. So lots of different ways to get blood clots. The one thing I do want to add to something that Justine mentioned, though, is that many people don't expect young people to get blood clots. And so often when people show up at the emergency room, it's not the first thing that emergency room doctors think of when someone's in their 20s or 30s or even their 40s.
Yeah, and it's interesting too, and just I guess briefly my story for anyone who's joining who hasn't heard about it. I do have a full YouTube video kind of chronicling this whole thing. Is mine was kind of interesting because it came from more of an anatomical, and it was because the blood flow was not able to get through my first rib. And with that, it then also did turn into a pulmonary embolism. And I think one of the things that's really important, I think for a lot of people, women, especially younger people who are experiencing these types of things, is to advocate for your health. You know, I went to the ER and definitely probably should have went a little bit sooner, but I kept thinking, no, this can't be a blood clot. And thankfully, you know, my family and like my mom, more specifically, she had always like taught us about blood clots because it did run in the family. So that was always in the back of my mind. So knowing and going into the doctors when obviously my arm was like triple the size and it was like purple, they clearly something was wrong, but I was very adamant about, I think this is a blood clot. And then, you know, getting that diagnosis and having them say, well, you're going to need to get your first rib removed if you continue doing these specific activities. Because I used to do a lot of sword training and lightsaber training, which was the craziest thing is that is now in my medical history of like being basically being a Jedi is the reason that I got this blood clot from the excessive repetitive motions like that. But that's never something that you would ever think. So, you know, if you ever do see those signs, to anybody watching, don't be afraid to go ask for help, get to the doctors, go to the ER because they're more medically equipped to be able to take care of those things. Now, I think it's also interesting because I feel like all three of us have very different stories. Kelsey, I would love to hear from you because you've definitely got the clot record here. So I guess congratulations. And I'm just so honored and happy that you're still here to be able to tell us about it. So for you, I mean, what were your symptoms and kind of just go through that story for us?
Sure. So none of my symptoms were really textbook, which made it each time very difficult to recognize that I was having a blood clot. But I will say the first blood clot that I had was the portal vein thrombosis in my liver. And my biggest symptom was my belly was very distended. It looked as if I was 7 or 8 months pregnant. Almost overnight, I would say within like 72 hours time. And I laugh about it now because it was around New Year's Eve and I was drinking champagne with my friends. And I just thought I was bloated from drinking champagne. So when I went to work, one of the physicians that I worked with looked at me and was like, "Are you okay, Kelsey?" And I was like, "Yeah, why?" And she, not being rude, she's like, like your belly is really big. Like you don't look like you are feeling that well. I think you should go to the emergency room. And I was like, "Dr. Carviti, I have a meeting in 15 minutes. Like, I'm not going to the emergency room." And she insisted that I went. And that day I didn't leave the emergency room for about 2 weeks. So that was my first experience and diagnosis with the symptom. But therefore, once I had my pulmonary embolism, I drove myself to the ER. I actually had very, very, very bad anxiety type feelings, and my heart was beating out of my chest. When I went to sit down, it felt like a stabbing pain in my chest, and I just thought it was abnormal. So I went to the ER and they said to me, "You have a blood clot." And I said, "I know, it's in my belly. It's not done dissolving. My body hasn't absorbed it." And they're like, "No, actually you have a pulmonary embolism." So all of that to say, I didn't have your typical textbook symptoms, but I knew what I was experiencing in my own body was not normal. And looking back, I wish I would have recognized it days earlier and taken action days earlier. As you had mentioned, you should have probably gone to the emergency room sooner. But I have definitely learned as I've gotten older. And I will say my last blood clot that was in my hand, it was in a superficial vein. I looked down at my hand and I noticed I had about a golf ball size lump on the top of my hand, and it was black and blue and very, very hard to move my hand. And at that point, I immediately went to the emergency room and was diagnosed with a blood clot.
And this whole time you've been on blood thinners as well, too?
Yes. So I was on blood thinners. I've been on various types of blood thinners, and unfortunately, I have had a blood clot on 3 different types of blood thinners.
Wow. I mean, Jean, what do you have to add to that? Because that does seem like it's, the blood thinners are supposed to be like our saving grace.
Yeah, no, again, I think this is a very dramatic story. And I think both of you had unusual presentations, right? We think deep vein thrombosis and you've got swelling in your leg and it hurts. And now we have someone who has a swollen arm. Again, from compression, I have to throw in, we celebrate World Thrombosis Day on October 13th. Because Virchow postulated this triangle, these 3 different components that combine to form a blood clot. And one of them is compression. So that's what you had, Justine, with your rib compressing the veins coming out of your arm. But Kelsey, it's surprising how many people actually have new clots or extension of old clots despite starting anticoagulation. And in the first 2 weeks after someone's on anticoagulation, we kind of accept a low rate of new events. So, I don't want to get all doctory here and say, well, how long were you been on it? And were you taking it? And did you miss a dose? And were you taking any like antibiotics that might have interfered with its activity? But there's a lot of factors that go into making sure that the anticoagulation is adequate. Even if you've done, quote, everything right, and I'm sure, people do everything right to the best that they can, they sometimes are not effective enough because that stickiness of the blood, the hypercoagulability is just strong. And then we have to do some other things like change the medication type or change the dose or look at interfering factors that might make the anticoagulant not as effective in you at any given time.
Yeah, no, thank you. And then someone also I saw mentioned in the comments that they are saying, wait, because you mentioned compression. They said, should we not wear compression socks when we fly? So that's a different type of compression.
Yeah.
We actually do want that type of compression to keep the blood flow.
Yeah, no, and so compression is when we talk about causing a blood clot is, if you think of your veins coming out of your legs, for example, as like, those paper drinking straws that if you get them wet, they kind of get collapsed. They're not like those plastic ones, which are kind of like the arteries. So if you have a plastic drinking straw, that's your artery. But the paper ones that get smushy and stuck together, those are like veins. And so if you have something pushing on that, it's very hard. The pressure is hard for the vein to push the blood past something outside of the vein pressing on it. Compression stockings are a different story though, because when you stand up or when you're sitting in one position, you make it harder for the blood to get back to your heart because gravity is pulling the blood down into your legs. Or if you're sitting in one position for a long time, you're sort of kinking off the veins, at that right angle where your legs join your body. Compression stockings put pressure against the veins in a good way to help the blood flowing back up to the heart. So yes to compression stockings, no to like tight tourniquets or tight braces or something that might obstruct the blood flow. It's a balance.
Thank you. No, that's great. Now, Gabby, I'd love to hear from your story as well, because I think that's also something that a lot of people don't realize is pregnancy can also be a huge factor when blood clots are coming into play. So I'd love to hear your story as well.
Yeah, so in 2021, after my second child was born, I had a kidney infection. I had a fever for like 7 days, and then I went to the hospital, and I stayed there for 7 days also. And as the doctors were checking my exams, they found a clot in my pelvic vein. Is that the right term? In my pelvic vein. And they were able to repair the damage because it was an early diagnosis. So the damage were not like as bad as we expected. So I almost didn't have symptoms, yeah, but it was bad. Like the medication hurts, and after that, I changed like a lot of things in my life. I started doing exercises. Every time I'm in a flight, like a long flight, a long trip, I try to walk on the plane, and I started paying more attention to these little things that can like prevent for this to not happen again.
Yeah, and I guess for you too, as an influencer and someone who shares like their pretty much, everything with the internet.
Mhm.
I mean, for me, I was like, do I share this? Do I keep this a secret? Like, what do I do? So what was that like for you kind of deciding to share your story?
I did share my story, but not like with so many details as I'm doing now. And I don't know, I shared like after I was discharged because I was comfortable with this. But when I was in the hospital, I didn't post anything. I didn't say anything because I didn't know like what was gonna happen. Like, you know.
Yeah, no, I did the same. I waited until after I was out, and then I could like
Yeah.
process things.
Mhm.
And then, of course, you just had a baby as well. So you've got so many different things on your mind. So what is this like kind of sharing this with your family? Have you kind of made your kids aware of this? Like, how are you kind of bringing them up to kind of, I guess, for their awareness of blood clots?
Yeah. My babies, they knew I was sick, but not so sick. You know. My family got really scared. They got worried, but my mom was with me the whole time. She took care of me, and she still does, because when you've been through this, like, you're not the same. Your life is not the same. You live like scared, and you try to do everything to prevent this to happen again.
For sure. And I think the thing with the pulmonary embolism too is when I also had one, it went to my lungs, and I was like, I used to run a lot. So I thought, oh, after I'm feeling better, I'm just going to be able to go back out there. And you really don't ever feel that same way that you did before. And you always have kind of that fear. And especially because that day that I got my clot, I also had gone for like a 7-mile run. And now I'm like, I can't even do that anymore because I'm like, I have that fear in the back of my mind, like, well, if I do that again, am I going to get another clot? But I think making those simple changes, especially in your health, I think is really important. And then Kelsey, for you, because you really don't know what is causing this. I mean, how has that been for you, changes that you've had to make in your life and kind of friends and family, because everyone has to be aware of this?
Sure. So in the beginning, I was a lot more private about all the circumstances and situations that were happening. I think because I didn't understand, and because I've done all the genetic testing and things like even into my family now, and I don't have any factor and everything's irremarkable or normal, other than having the diagnosis of having a blood clot. That I was more private, but just the changes that happened in my life, especially I didn't lose my job, but I was on medical leave in my early 20s for 6 months at one point. And then figuring out like, where is my career going to go? And I was in grad school that then started sharing more and more and leaning on to my friends for support. And I will say that they were absolutely incredible, but I did have a few friends that I don't think this is talked about enough that didn't understand how could this have happened. But then 2 months from now, you took a vacation somewhere. They didn't necessarily think it was 100% truthful on my end. So it was really hard navigating all of that. And I think just as it's continued to go on, I've really leaned on my friends and family for their support. I have kind of just now I've started my own business because I'm like, this is the direction I need to go with myself. But it's changed my life in that it has taken my passions that I was more just excited to do like outside of work and school. And it has made me literally create a career and a lifestyle out of things that I once didn't take for granted, but I didn't know, like, one day it could all be gone. And I had that realization in the hospital, thinking, man, I just bought a new SUV. I'll never forget laying in the hospital, like my car payments due. I just have this new SUV. I'm supposed to be going on a trip. I can't do it. Like, all of that's taken away. So I think experiencing that in my early 20s has now put me in my early 30s, and I just live my life completely different. And taking precautions. Like we said, I wear compression sleeves, I wear compression socks. I actually do not take a flight that's longer than 5 hours without taking a day layover, and taking anticoagulants and blood thinners every day and not missing a dose. And I will say that my friends are amazing. One time I was walking downtown Houston, the roads are terrible, and I almost tripped. And my friend literally grabbed me and was like, "You are not going to fall hard. Like, I'm not going to let you touch the ground and hit the ground on blood thinners." So it's been a whirlwind, a roller coaster, but I will say I am very grateful to have experienced all of this.
I thought it was interesting. As soon as I started on blood thinners, I hit my head all the time for some reason, because it was in the back of my mind of like, you can't hit your head, don't run into anything. I was running into everything, not hard, but like it still was just like, because you become so hyper aware of it. I mean, there's so many things that you can be afraid to do, like even riding a bike, because I'm like, well, what if I fall? And there's so many small things that you do have to make adjustments. But I think there's one thing or a piece of advice that I've kind of found throughout this whole journey, and then just even like my journey through like martial arts, is when you have an injury, what else can you do instead of that same thing? Like, if you can't do this, like what can you do to kind of develop yourself outside of that? Like, okay, well, if I sprain my ankle, I think I can kind of still do some push-ups on my knees. So it's kind of figuring out ways to kind of live a new life. And it's not easy. And I think, talking with loved ones and even just the internet, I am so glad that I had my audience, because I found so many other people that had the same exact diagnosis that I had. They were telling me about their rib removal surgery, and they're like, look, here's my scars. And it was just people sharing such vulnerable pieces of their lives. And I think that's really so special about the internet. And, Gabby, for you, did you kind of have anything similar to that when you shared your story?
Sorry, what was the question? Sorry.
Oh, when you shared your story, did you have a lot of your audience kind of share their own personal stories?
Yeah, totally. Actually, today when I posted about the live, the stream that we were doing, everybody commented like, "Oh, I have someone in my family who already been through this. I personally have been through this. It's so hard." So I think everybody knows somebody that has already been through this. And once you talk about this, you get surprised about how many people have blood clots and things like that, and nobody really talks about it at all. So it's good for us to share, so people don't feel alone.
Right.
I'm
Jill, did you
going
have
to
something to
jump
add?
in. Yeah, Justine, I want to jump in because I think this is very important that people talk about it and get support from many different areas. But one of the biggest groups, and sometimes it's hard if your family's living in different places to actually find out what your family history is, right? Because if you have relatives who've had blood clot and your relatives have had them at a young age, you are likely at an increased risk for having a blood clot as well. And so knowing your family history going into things may be very helpful. So, if your father had a blood clot at age 40 or age 50, sometimes depending on how old you are when they have a clot, you may not really be aware. Your parents may not want to tell you if you're 10 or you're 12, and they don't really understand, well, yeah, daddy was in the hospital, but what does that mean? And so finding out, and when you get to your 20s and asking your family, sometimes even before you have a blood clot, can be very important family information to know.
Yeah, something else that was kind of interesting is because like I have a very low blood pressure and like heart rate. So when I was in the ICU, my sister was there, and we basically, because we're super tech savvy, so like we have all like these tech gadgets, so we know like our heart rate, we know our blood pressure, and she was just looking at the machine and she's like, your blood pressure is rising, like your heart rate's high, which for a normal person it wasn't. So like we called the doctor in, and I started feeling like something weird in my chest, and I was like, something doesn't feel right, I feel like my heart rate's elevated, and they're like, no, that looks good, that's normal. I go, that's normal, but that's not my normal. So I think for anybody who, just take your blood pressure, go into the pharmacy one day, just put your arm in that sleeve every once in a while and just kind of know your base, because I think that's super helpful, especially for doctors, because they don't have that history of information. Do you have anything to
Yeah.
add to that, Jean, that we should be kind of looking for?
Yeah, no, I think, knowing your own baseline heart rate and knowing that, we may not think 90 is or 100 is really high for most people, but if your baseline is 50, that's twice, right? And so I think the other thing that I think you, Justine, or maybe it was Kelsey or even Gabby or all three of you mentioned, is that this feeling of anxiety, right? With pulmonary embolus, like you're not quite sure what's going on, and your heart rate is usually higher with a pulmonary embolus, and it's kind of hard to tell where that's coming from. So don't ignore those kinds of symptoms. Definitely if you've had a pulmonary embolus or even a DVT or any type of blood clot in the past, I always tell my patients, do not be afraid to go to the emergency department and say, I've had a blood clot and I'm worried I have one. No one will say you shouldn't be here, you're crying wolf. They should really check you out to make sure that you don't have a blood clot.
Now, I mean, Kelsey, we heard some of your symptoms. I mean, Gabby, did you have any symptoms? You said you didn't really have any, but they still found it anyway.
Yeah, I didn't have symptoms at all. Like, I had a fever. That was the only symptom. And I think it was a miracle that I went to the hospital, because I thought it was like a throat infection or something like that. But the fever kept like for 7 days. So I think it's time to go to the hospital, because I've been taking medications for the fever and nothing's working. Okay, let's go to the hospital. And as I went to the hospital, and it was a coincidence that they found the clot into the Portuguese, sorry. So I think it was a miracle, because I didn't have symptoms at all.
I mean, you still had that fever, which thankfully you were able to kind of know that that's not normal. And how long after was this when you had your first or your pregnancy?
It was my second pregnancy.
Okay.
My baby had like 3 months, 4 months, almost 4 months old.
And Jean, I guess, I mean, I don't have any children, and I'm not familiar with, how all of that works as far as like clots and pregnancy. Can you explain to us kind of how that works? And is that kind of a normal thing to happen? Does it happen right after pregnancy, 3 months? Like what is the usual kind of thing that people should look for?
I know these are very, very good questions. As I sort of alluded to before, both estrogen containing oral contraceptives and pregnancy, when women have either one of those going on, they're at very, very high risk for getting a clot, because the estrogen levels increase the pro-clotting factors, and they decrease the natural anti-clotting factors. And we do a lot of hand waving about thinking that may be, historically important and allowed people to survive childbirth because you're in a more pro-clotting state. And that state, continues through pregnancy and at least the first 6 weeks after delivery, although some people would argue up to 12 weeks or 3 months later. Your hormones are fluctuating, and it's basically pregnancy is a hypercoagulable state. It is even potentially a stronger state than, say, if you have a heterozygous or one copy of the factor V Leiden gene mutation, which is an inherited blood clotting disorder. So it can be very, people need to look out during pregnancy, after pregnancy for about 3 months, at least 6 weeks. and if they're taking birth control pills. And I think that I want to stress, for like women in their young 20s, not to ignore symptoms of DVT or PE, because we do see that patients develop these unexpectedly on these contraceptives. But Gabby, it sounds like you were sick, right? You had a kidney infection, you had a fever, you had a throat infection. Infection can be a source of blood clots. People who get admitted to the hospital are at risk for getting blood clots. So if you put in what we call the postpartum state, your post-delivery, you've got an infection, you've got a fever, you're in the hospital lying in bed. I don't want to say it's a no-brainer because my kids tell me that phrase is out, but all those things add up to make it easier for you to get a blood clot.
I'm also reading in the chat as well. So I think that there's so many other people that are sharing their stories. So thank you guys so much for sharing those. We do have a question here that says, is there an age when women should stop taking birth control pills?
That's an excellent question. And so there are data that definitely show. So first of all, the risk of getting a blood clot just increases with age, and it really takes off at age 60. So that's why if your grandmother had a blood clot at age 80, we're less worried than if your uncle had a blood clot at age 40. There are data that are on the CDC, the Center for Disease Control website, about the risks with age. Certainly, the risk we believe goes up after age 35. And if you smoke, that risk is significantly increased. But when women start to get over 40 and 45, we suggest if they need some sort of hormonal treatment, they use other formulations than the estrogen, progesterone, birth control pills.
Yeah, I feel like this is something that no one has ever taught. You would have no idea, especially at a young age, like, oh, birth control. Okay, I'm going to take that because I don't want to get pregnant. But then there's so many other side effects. And I think there's so many side effects for all sorts of types of, medications. So you really do have to look into that because it's a side effect for a reason. Something else that I'm curious about with all of you ladies is how was your mental health kind of afterwards? Because I know I was just a wreck. Like, not only did I feel like I was never going to be able to do any of my favorite activities again, I thought like I basically just felt like I was like a prisoner now. Like I couldn't do anything. And I mean, this is now like a year and a half later. I'm doing all my favorite things. I'm running again. Got back to jujitsu. So it takes a lot of time and I think a lot of patience with yourself. So Kelsey, like how have you been dealing? Because obviously this is something that you're still dealing with. And I would love to hear kind of like your coping mechanisms. Because I also feel like this is incredible. You've started a business. So you've kind of created, this lemonade out of the lemons.
Yeah. I'm generally a very happy, non-anxious person. I thank God for that. So I would say overall in life, my mental health, I feel like I'm thriving and I do have a very strong, healthy mental health. However, I could see how if I allowed myself to worry about these blood clots that I've had and potentially having blood clots, it could be a really scary downward slippery slope. Specifically, and I don't think this is talked about enough, the finances that come with being ill and going to the hospital or just even going to the ER because you're scared that it might be something. That's probably one of the most triggering things for me, is thinking how much money I've spent and how much money I still owe and how much money I'm probably going to owe in the future. And also thinking my mental health around child planning. I always used to say I don't think I would ever want to have a kid, but that was before meeting my significant other and falling in love. And now I want to have a baby and I would love to be a mother, but I'm terrified, to be honest. And my hematologist and my PCP, they have now since retired. They're amazing people, but they've been with me from the beginning, So my coping mechanisms are really just I believe in God and I lean onto him and put faith in everything into him. And I think to myself, if I was supposed to be dead and gone by now, I would be. So I'm supposed to be here fulfilling my mission now and just trying to put as much positivity as I can in the world, but I'm not invincible. And I can say that there have been times where I'm like, oh my goodness, like this is going to be so expensive. Or I felt like I could have a house by now, or I could have this, but I had to put my money somewhere else, you know? So my mom is a mental health therapist, and I advocate for therapy. I think that you should be in therapy before you need therapy. And I always tell people I recommend that. It's not just for broken people or people that don't know where to turn. And I think talking to people that you trust and my faith is what has helped me through all of this.
That's amazing. No, and I think you've gone through so much. So just to be able to hear how you've come out on the other side, I think is such an inspirational story for so many other people who are struggling with this, especially if, you know, you're fresh off the clot. Like it really is traumatic because it doesn't seem like you have the information. And that's why I think, you know, just being a part of and finding the World Thrombosis Organization was so incredible because they have so many resources for people, whether, you know, this is your first clot, your second, and you're dealing with that. It's just been really amazing. And so Gabby, for you, I mean, how has that been kind of, you know, dealing with not only the clot, but also your family and trying to like keep your cool and keep everyone together?
Yeah, by the time I had the clot, it was really bad for my mental health. But after that, I think it was really important for me because it made me more responsible with my health, with my body, with everything, especially because I have 3 kids, so I'm not alone. They depend on me. And I think therapy, as she said, is really, really, really important. Like, I've been on therapy since then, since I had the clot, and it's really important for me. And that's it.
Yeah, and Jean, do you have any other recommendations for people who, you know, may be struggling? Like, where do you even look or go to for help? Because I feel like a lot of people just might feel stuck. Like, well, what do we do now?
No, and this is great. And it's great to hear and watch actually the 3 of you discuss what's very common in people who've had blood clots. Some patients, you know, describe it as PTSD, right? They get short of breath and, oh my gosh, all the, you know, being in the intensive care unit or being in the hospital. Or Gabby, it sounds like you did the injection type of anticoagulants, like enoxaparin or some sort of low molecular weight heparin. So, I do tell patients that doctors and nurses and nurse practitioners and physician assistants don't know what you're thinking. So you need to let people know because they can provide you with resources. But sometimes traditional medicine, we're so busy day to day that we're not the best at pushing out those resources. And so don't be afraid to look. Either to speak to friends, but social media, as someone said, has become a great way to spread information, both usually upfront and honest and correct. And sometimes you got to take some of it with a grain of salt. There are known societies out there that are advocacy groups for patients who've had blood clots. And you can find these resources on the World Thrombosis Day website. Many of these forums and foundations and societies hold webinars. They hold support groups. They have once a week, you know, just like we're doing now by Facebook, group support sessions, not necessarily bona fide therapy or one-on-one, but it's a way to share information and deal with the stress and deal with strategies for, you know, situations in the future. So I encourage everybody to look for those you know, be on the lookout and share, you know, sharing your stories like you are now opens many people's eyes to the fact that thrombosis exists. And that's a great start.
Yeah, I mean, for me, definitely like relying on my audience, you know, I feel like, you know, I post content all the time and it's super happy. And then for them to see sort of this traumatic thing happen, but like I know a lot of them are watching right now. So like I could not be more appreciative of how many people shared their stories because that's hard, you know, it's hard to share. But then I am still a stranger and they're sharing that with me and the ways that they were able to cope has been so helpful. So thank you to everyone watching and thank you to everyone who has shared your story. Like we definitely really appreciate that. I guess again for Gabby and Kelsey, whoever wants to answer, if you guys both want to answer. I mean, for you guys now kind of going forward, is there any kind of support or any message that you want to give out to people to kind of just let them know, like, hey, it's okay. You need to, if you need to get checked out, like this is what you should do.
Sure. So I remember being in the hospital and thinking, I'll be back at work in 2 weeks or something, and hearing the physician say, we don't think you're going to be back, because my portal vein thrombosis caused a lot of issues down the road with my pancreas, and my gallbladder had to be removed, and a lot of GI issues followed after that. And I remember them saying, yeah, we're thinking minimum 6 months. And my mind was like, 6 months, my world is going to end. Like, no. And I mean, it's been 6 years now, right? Like the time went like this. So I encourage everyone, especially people that feel like you need to go to work and you have to support your family and you can't be taking off to go to physician's appointments, do it. Because what you do now to make sure that you are changing your life to get better will protect you and make it that much easier and potentially heal you of all of your ailments that could be worse if you put it off. Go to the doctor. And another thing about it is, if you're scared, I know there's been so many times where I'm like, Mom, I cannot go get that CT scan. I'm too scared. What if something comes up? I don't want to go get those ultrasounds. Do it, because early detection is so important. And it is literally key to, I believe, the outcome that you want in the end of just being free of the diagnosis. And I don't want other people that are in our shoes to worry about all of the things that don't matter, because at the end of the day, your health and your happiness matters. And without either, what's the point? So that's something that I really preach into people. Even if my friend's son, he broke his leg, and I'm like, you better go to that physical therapy, because you don't want him to step down a curb in 10 years and break your leg. Like, so that's my best piece of advice to everyone. Don't let the time in the doctor's appointments deter you and the fear.
It's funny you mentioned the time frame, because they did the same thing. They're like, okay, we're going to have you on blood thinners for at least 6 months and then we'll reassess. And I was like, wait a minute, that's a really long time. And at the time, I also had a vacation planned the next week. And I remember coming out of the operating room the first time, and I was like, I've got all these random videos that my sister filmed, which I'm glad she did, because they're kind of funny looking back now, but at the time, not funny. And I was just on, coming out of the drugs, and I was like, do you think I'm going to be able to go to Hawaii in 2 days? And they're like, sure. Yeah. So I took that video and I was like, remember when you said I could go to Hawaii in a couple of days? He's like, I didn't think you were going to actually bring back the proof. He's like, no, you can not fly. Which is kind of interesting, because I think a lot of people don't realize, flying also can be a source of a lot of blood clots, because you're at different, elevation. Jean, I want to talk to you about that, but before, I would like to get some advice from Gabby. Do you have any advice for people who may be going through something similar, or if they have any symptoms?
Yeah, I think do your checkups like often. Don't be scared to find something, because as she said, early diagnosis can save your life and make the damaging low,
Yeah, definitely. For sure. Yeah, the early detection.
Pay attention to your body, because it speaks to us. So the symptoms are quiet, but they are there. So pay attention.
For sure. Yeah. And so I also travel a lot. And I mean, Jean, like, what should we be doing? Obviously the compression socks, but there are other things too, that people might not. Cancer treatments can also be a huge source of potential blood clots. So I guess I've got so many questions for you. Okay, so we need some travel tips, and then also, what are some other things that can cause clots that might not be as common that we think?
Yeah, no, and before we even get started on that, I want to echo, do not be afraid to go to your medical care team. We will write you a letter that says you were there, and hopefully that will excuse your managers and your work from having any repercussions on you for taking care of yourself. So flying in, we all there are not a lot of great studies looking at people who fly, right? Because millions of people fly, but not everyone gets a blood clot. And so there are factors that increase your risk. And we've talked about the length of travel. But I've seen people get blood clots with flights for 3 or 4 hours. So again, you have to have your own individual risk factors. Getting up and walking around every hour, wearing compression stockings, absolutely. One thing that I find even in my own field, I'm a very sub specialist in hematology that does coagulation and thrombosis. And not every hematologist does this. Not every cardiologist is up on this. If you've had a blood clot before and you are not on anticoagulation all the time, one of the things that I do though is give people anticoagulation before they, that for them to take before they get on the plane. So discuss that with your doctor. There are not a lot of data, but those of us who really do coag know that this works. I'm trying to spread that information on the medical side. And then, lots of different disorders. So as Justine mentioned, cancer itself increases your risk for getting a clot just by having the cancer. And some cancers are more prothrombotic or more hypercoagulable. Cancer treatments can do this. Being significantly overweight increases your risk of getting a clot, just like having a heterozygous prothrombin gene mutation. So hopefully that will encourage people to maintain their weight and work to get at a reasonable weight, a body mass index of 30 or below. Other factors are medical illnesses. We see people who have flares of inflammatory bowel disease, rheumatoid arthritis, lupus, other types of disorders like that. When they're active, can cause blood clots as well. So be aware of your own family risks. I think that helps. Don't be afraid to bring it up with your physician, no matter what is going on. Say, hey, my, father had a blood clot at 40 and his sister had a blood clot, because all of that's important information for your medical care team to know.
So now going forward, I think we're all kind of in our healing phase and we're all aware of blood clots at this point. So I guess, is there anything that you guys are now doing differently than you used to? Are you like super hyper aware? Like what has changed kind of in your day to day? Gabby, if you want to go first.
So I think the main change that the clot made in me, it was in my head, because I didn't go to the doctor to do checkups or things like that. I was not responsible at all with my health, with my food, with exercises, some things that make difference. And now I pay attention to every detail, to everything that can make the situation worse if there is something happening in my body. So I started to pay more attention, and I think that's the main difference that I had.
And Kelsey, what about you?
I echo that as well. I mean, I never had to go to the doctor when I was younger. I never was sick until I got sick, really. But I would say for me, probably maybe it's a different answer because it's been ongoing for me and it keeps appearing. But if things don't make me happy or genuinely bring me joy in my life, or relationships I don't have time for it anymore. I also, my background is in healthcare, and I've seen people come and go, and I've seen the other side of people not surviving. And I think, the importance of how beautiful and delicate life is. If it doesn't serve me a purpose, then it might be a great purpose for someone else, but it's just not for me. And that's what I would say constantly having these scares has really taught me. And it's given me an outlook on life to where I just, despite the craziness, I'm just happy. And I don't know if I would have that had I not experienced all of this.
That's a really incredible outlook. And I think that's super helpful for a lot of people because when you do first get this, you are sort of in this state of confusion, and just hearing that, you're still going through this and having such an amazing positive outlook, I think is super helpful. And it is really, it's scary. And especially I think because it essentially is sort of this invisible disease where you would look at us and we're like, oh, you guys are all perfectly fine. So it's hard for people to think that there's something wrong with you. And, getting people to believe that, like you, Kelsey, were talking about like taking off work and then going on a trip. And they're like, well, wait, I thought you were sick. You're like, well, yes, but I think the education process is very important. And I guess going back to that too, the medical bills, because that it is very expensive. I mean, ending up in the ICU for days and all of that care that you need. I guess, Jean, for you, I mean, what is your best suggestion for people? Like, making sure you have health insurance, but what if you don't have health insurance? Like, what should we be doing?
Yeah, no. So this comes up because I never talk politics, but the Affordable Care Act has made it easier for people to get insurance. I have family members who own their own business and sometimes have gaps in their medical coverage, right? And yet then something happens and they need to see someone. You should get the medical care you need, and you should not be afraid to go and let that keep you, no matter what your insurance status is, no matter what your status is in the United States with regard to citizenship and everything else. Go to the emergency room, get treated if you are concerned about symptoms that are typical or not typical, as we've discussed in the last hour. They may make you pay, but you can pay $10 a month. You can pay $5 a month. It may take you a long time, but it's important to get the care. And the financial side of the hospital is willing to work out many deals based on what you can afford. And lots of other things I could go into there. There are a lot of hospitals that are considered safety nets, and they treat people for free. So do not let any financial issue stand in the way of getting care. What I do tell my patients, though, when they get bills, do not pay on the spot. Okay. Wait for those insurance companies to haggle it all out. Let the hospital haggle it all out with the insurance company. And then also, and that can take months. So do not be dismayed when you see these large medical bills showing up and that you have to pay immediately everything and sell your car and get rid of your house. Do not do that. You can tell it's a little strong opinion of mine, but that's advice I give my patients. All right. Do not be dismayed. Call the financial office at the hospital wherever you were cared for. Do not give it all up, and let those, if you have insurance, let them haggle it out. If you don't, there are still mechanisms where no one's going to make you destitute.
Thank you so much. I think that was super helpful, because I mean, we're sitting there in the hospital and my sister was just like, how much do you think this is all going to cost? I was like, I'm not right now. Can we just wait later? And, when you do get those bills, it is absolutely shocking. And, I'm not sure what the healthcare is in Brazil. It may be a little bit different. So I guess it's definitely very different here in the US. So what is that like for you, Gabby, in Brazil?
So I have health insurance. I have a good financial situation. I don't know how to say that in English, but here in Brazil, we have like public hospitals for free. So I think for the people here, it's like easier, to find the diagnosis and take care of your health.
I would like to add that, speaking of the financial piece and insurance, I just recently, as of this year, have finally branched out because I got the confidence to start my own business. And the biggest piece of that was, I'm not going to have health insurance. That's what was like, I can't do this. And so what I did is I called people that I know in my town that I lived, and I said, does anyone have a job for me that I can do to have health insurance? And it's hilarious. My mom and I laugh about this all the time. I am the attendance lady at a junior high by day, and at nighttime, I'm doing my own business. But you know what? I have health insurance. So I don't want people to be discouraged by thinking, oh, I can't do this because I can't follow my dreams because I'm going to need health insurance. There's a way, and you can do it. And it might be funny and it's crazy that my life has ended up here, but I'm still doing what I love and I made it happen. And I don't want people to be discouraged thinking that like this is the only way. There's always a way if it's meant to be. And I just really believe that from the bottom of my heart.
That's such incredible advice, and I'm just so appreciative that you guys are all here. We only have a few more minutes left, so I guess I'll just go around and you guys can share any last words of encouragement or anything that you feel like sharing. Jean, we can start with you.
Yeah, no, well, again, I think this is excellent. I think people should feel free to share their stories. And by the three of you, Justine and Kelsey and Gabby, sharing your stories just opens up people's eyes to the fact that blood clots exist and that they occur in young, otherwise very healthy people. And I think, for people who are watching this live, worldthrombosisday.org is our website for World Thrombosis Day. There is a lot of information on there. If you have friends or family members who've had a clot, definitely share that information with them. There are a lot of support groups out there, but also be aware of the risks and your own family history, the risks and the signs of blood clots, so that if you think you have one, you know what the signs are, and you go get prompt medical attention. So thank you for having me tonight.
Thank you so much. And then Gabby, do you have any last words for anyone or anything else you'd like to share?
So the message that I want to share is like, take care of your body, because you see on the internet, you hear stories about diagnosis, and you never think it's going to happen to you till the day it does. So take care of your health. Don't be afraid to go to the hospital, even if it's nothing. You have to know if it is nothing. It is really nothing. So don't be afraid, and everything will be okay. Anyway.
Thank you so much. And then Kelsey, you've shared so much already with us, but I would love to hear some last parting words from you.
Sure. Well, first, thank you all for being on here with me, and Justine welcoming us to your channel. Just everyone on the panel. And I really want to take in World Thrombosis Day, but I really want to take this time to say two things. One is, all of the time I get when I go to the emergency room, you don't look that sick to have XYZ. And it's so frustrating because I'm like, okay, but I am. This is the diagnosis. So I just want healthcare providers that are listening to maybe not use that language, because you don't know what someone's really going through until you get the results, to say like, oh, you don't look that sick. Like, well, now I got to go to the ICU. So that's something that I would like to educate healthcare providers on. And then also just to advocate for yourself. Like everyone has said, to know your baseline. It definitely makes a big difference in the end. And taking the opportunity just to say thank you to all of the healthcare providers that have been on my team, that have now retired, or that are still on my team. If you're listening, I sent you the link. I hope you are. I couldn't be here without you. Thank you to my friends. Thank you to everyone who has supported me. And I hope that if anyone needs any acts of words of encouragement, prayer, just to speak about anything that has to do with World Thrombosis Day or blood clots, my door is always open, and I am here to help and be an advocate or just a voice for anyone that needs it.
Oh my gosh. Thank you guys so much. This was so much fun. And thank you to everyone in the chat. We have been reading all of your super inspirational stories. And again, this entire stream was in honor of the 10th anniversary of the World Thrombosis Day. And you guys can check out more information at worldthrombosisday.org. And you guys can get involved in the campaign. Share this with your friends, share this with your families, because you really never know when this might affect you or someone you know. And just this small piece of information could save a life. Yours, your friends, your family, you never know. So feel free to share it. Take a look at the websites and just kind of get informed, because I think that's the most important part, is just having this in the back of your mind. If you ever have any of these symptoms, or if you ever spot these symptoms with a friend or family, you really could save their lives. So thank you again, Jean, Gabby, and Kelsey. You guys were so incredible. And thank you to everyone for watching, and happy World Thrombosis Day. Bye, everyone.
Bye.
Thank you guys so much.
Thank you.